All right, welcome to the Dr. Lexi Show. Today I have a very special guest that everybody knows about anyway. Marybeth Tomory, like amore.
There you go. You
Yes.
got it.
There is World Twin-to-Twin Transfusion Syndrome Day, or TTTS Day.
Mm-hmm.
That's December 7th.
Yep.
I wanted to have something on here too that was like, just not even big stories, but like, can you think of a set of twins that you saw where you were like, you put your probe down and you're like, snap.
God damn it.
You know what I mean? Like where you're just like,
I do. I have a case that, I mean, definitely has, she had early on, she had everything wrong that could go wrong. So everything wrong. So she had MODIs, she had 2 velamentous cord insertions, and she had a subchorionic hemorrhage retroplacental. So she had this big subchorionic hemorrhage behind the placenta. She had 2 velamentous cord insertions, MODIs, early onset twin to twin, donor recipient. Her recipient ended up with like a pulmonary stenosis. I mean, just everything.
how many weeks was she when you first saw her?
She came to us, I want to say, in around 16 weeks.
So early.
With a MODI,
Yeah.
with a MODI diagnosis.
Good.
So she did come in, but it very quickly went poorly. Like very quick. The subchorionic hemorrhage was big. I mean, the further her uterus grew, kind of the more velamentous those cord insertions became. I mean, just everything was wrong. And she ended up going to Colorado and having her laser
ablation.
Yeah, I was like, is it ablation? She ended up going to Colorado, had the laser ablation done. And then we were just in this like watch and see. And we saw her sometimes 3 times a week because these twins were just so precarious.
Yeah.
I remember standing by that door. Now, this is also COVID. This is primetime COVID. She has no support system. It's only her and I in the room, right? So you become like, it's so personal and it's so, like, so I would stand by that door, call her name, and please, God, let these babies be alive, right? Like every day, every time I called her back, I was like, I mean, it was almost painful. Like, I'm like, oh my God, please, and so she ended up developing TAPS after TTTS, which we'll talk about that. But, and then she ended up with preeclampsia. So everything that could go wrong in that pregnancy went wrong. The girls just turned 3. I was just invited to their last birthday party. I wasn't able to make it, but I mean, like, talk about like literally everything that could go wrong.
All the things
went wrong. And thankfully she ended up with 2 healthy girls, that was so emotionally draining, yet so rewarding simultaneously. Like that's it.
Okay. So for twin-to-twin transfusion syndrome, let's spend some time on why do we care about twin-to-twin transfusion syndrome? Because you can see it in maybe about 15% of cases, let's say, of MODI twins.
Yep.
Sometimes I feel like that's more common than that, but it ebbs and flows. Like I feel like some days.
I feel like all my stuff on this is very skewed.
Yeah.
And they're like, how often do you see identicals? I'm like, I got 4 this week.
Yeah.
I got TTTS.
Don't you feel
I don't
like
know, 3 cases now.
Like
right?
one day you'll scan all twins and then like for 3 weeks, it's like nothing. Twins. It's weird.
Yeah.
Okay.
Mm-hmm.
So.
But in MFM, we're seeing all those patients all the time. So like, what is happening in the general public? I feel like I'm out.
Yeah, that's a good point.
My numbers are skewed.
Yeah, for sure. For sure. So for twin-to-twin transfusion syndrome, screening. We screen for this thing every 2 weeks, basically.
That's why because you have to be looking to see it.
You have to be looking.
Mm-hmm.
Now, when we go to say what is twin-to-twin transfusion syndrome, the one thing I like patients know is you would never know you had it.
Oh, yeah.
So when you're carrying
feel
twins,
any different, you won't. There'll be nothing.
No signs. And there's nothing that you are doing that is causing it. People
or
have to know that.
Can do. There's nothing you can do to prevent it.
No.
It's nothing.
No. Now, the one thing I tell all pregnant patients, baby aspirin is recommended.
Mm-hmm.
That's not going to make or break twin-to-twin transfusion syndrome. So don't think if you didn't take the aspirin or you started it too late, you want to start it by 12 to 16 weeks. Don't think that would make or break this. This is a placental issue.
Yep.
That doesn't show immediately, but it shows as the babies grow and the placenta grows.
It's a gradual thing. It could be slow. It could be fast. It could be like, but it is gradual.
Yes.
Mm-hmm.
So when you're doing an ultrasound at that every 2 week mark that usually starts around 16 to 18 weeks.
Right.
What are you as an ultrasonographer looking at in like layman's terms for like a patient,
Right.
and then a little bit maybe into an ultrasonographer
Yeah.
version. I know it's like break down your brain into two parts.
I know. I was like, oh.
I know. I just like if I'm the patient and I'm like,
Yeah.
hey, I have Modi twins and I'm
Yep.
having my screen for that twin to twin thing.
Yep. Mm-hmm.
What would you tell me you're looking
Yeah.
for?
Yeah. I think for a patient, it's good to see that you can see the membrane between the babies kind of float freely.
That's
right?
a really good point.
It's a good, like you should see it. I like to think of it like if you were hanging a sheet out to dry, right? In the Texas summer, if you will, right?
Yes.
So if you're hanging a sheet out to dry, it should flow with the wind. Like it should be mobile. It should move when the babies move.
Yeah.
Like they can't touch each other. Like you got two kids on the side of a sheet, right?
Yep.
They can't touch each other, but it should be nice and flowing.
Yep.
And when you look at kind of the bubbles that the babies are in, they should be about the same size of the bubble.
Good point.
So you have two bubbles and a nice free floating membrane between. That's for a patient, that's what you should be looking at.
And how I usually say that too, for different ways to say it, similar to that, we want to see a membrane or a line between the babies.
Mm-hmm.
I want to see that their swimming pools, I call them swimming pools.
Nice. Yeah.
Their swimming pools are
Yeah.
about the same.
Yep.
And then we always will take a look to see that they have a little stomach bubble and
Yep.
a little bladder bubble.
Yep.
And then we know they're peeing and swallowing pretty good there for you.
Eat, drink, pee.
And that's, so bubbles, right? You want the big swimming pool and then the bubble. And that makes me happy.
Yes.
Because
Yep.
my first thought for twin to twin screening is one swimming pool is too big
Yes.
and the others is too small.
Because that is the first sign. First sign. They're going to be in their little swimming pools and their bubbles. They're eating and drinking. So we'll see the bladder.
I know I did this earlier. I was like the stomach and I was like, nope, that's a bladder.
We are highly educated people.
Yes, we are.
The bladder.
It's like doing this at the same time or whatever. Like, yeah.
But when they're doing all that, you're going to see fluid in the stomach. You're going to see fluid in the bladder, but you'll see that difference between their bubbles.
Yep. Okay.
So they're similar to that. So from a patient perspective, that's kind of what you're looking at.
Yes.
For a sonographer perspective, it's really important that we determine who A is and who B is. And that we do by really describing the house that they live in. So we want to look at what are the things on the babies that cannot change, because we don't want to keep jumping back and forth between who A is and who B is. And baby A is not the baby closest to the cervix. It's the baby in the sac closest to the cervix. That's very important distinction. And when we're talking about placentas, those are not going to change. We're not going to go from anterior to posterior, and they're cord insertions. So once we kind of map out who the babies are, and it's super helpful if you have like a velamentous cord insertion, like a cord that's hanging off the side of the placenta, then you always know this baby with this cord insertion is in the sac closest to the cervix. That's our baby A. So when we talk about donor, recipient, we talk about our giver and our taker and our low fluid and our high fluid. It's really important that we determine who baby A is and who baby B is, and we stick with it.
Yep.
That is the most important thing. So we do that, sonographers, we need to learn to do that by focusing on the things that do not change through a pregnancy. So we're always looking for any tiny little differential, and that's how we can kind of keep them straight, because it's very important to not jump back and forth, especially after
get to twin transfusion syndrome.
14,
the fluids. Tell me.
16 weeks. Shit.
Tell me.
I know I keep jumping.
I know.
But for a sonographer perspective,
they're going to measure what and what.
We want to know who A is and who B is. We want to keep them. We want to measure our deepest vertical or maximum vertical pocket, as big as you can get. Doesn't have to have the membrane in it. You are looking for your biggest pocket no matter what.
Yep.
And you want to see stomach, bladder, kidneys on every time you're looking for MODIs.
Perfect. And then if someone ends up getting a diagnosis of twin to twin transfusion, there are different stages. You should make sure you're talking to a maternal-fetal medicine specialist if there's concern for that. Yep. And then they oftentimes will refer you to a fetal therapy center.
Yeah.
So that's kind of general twin to twin transfusion.
Very much so.
In a nutshell. Twin to twin transfusion day apparently is December 7th.
Okay. Tell
me really quick to the hashtag or your thing on Instagram and all that jazz.
I am Sonoeyes Ultrasound on Instagram. I mean, I'm technically on TikTok.
Is it the same thing?
I think it's sono.eyes. That's what I'm on TikTok. And of course, I'm on LinkedIn.
Yes.
Things like that. So
all the things.
Yes, all the things. Facebook too. But really, my Instagram is where
Okay.
where the majority of my content lies.
Well, today we did a lot of discussion about twins. Thank you very much to Marybeth Tomory for all of her help and guidance. with
Thank you for having me.
Everything ultrasound related, which is fantastic. And we'll have you back again as long as you'll come back.
Anytime.
We'll make it a
Yep.
regular stop here.
Mhm.
But we hope to have expanded your knowledge, developed some skills, and as always, we want to have an impact on you and your pregnancy. I'm Dr. Lexi, wishing you a happy and healthy pregnancy.